Welcome again. This is the Sports Clinic webinar series number 9. It's been a while now. I think I'm ready to go back, but I'm enjoying the process. Today we got Maria in the house. Funny enough, we had Maria join our team at the Sports Clinic at UTM just before all this stuff started, so we actually never got going. I just figured this would be a great opportunity to introduce Maria to the Sports Clinic and the Sports Clinic family. So introduce yourself, Maria.
Thanks for having me on. This is actually my first webinar, so it's exciting to do something different during this time. I am what is called a registered dietitian, and I'll talk a little bit about what that means in terms of registered versus the word nutritionist. I have an undergrad in nutrition, and I also have a master's in health sciences, specialized in nutrition from the University of Toronto. And I have a variety of experience. I'm a well-seasoned dietitian, if you can say that. My focus in the last 15 to 20 years really has been on promotion of nutrition and prevention of disease. I'm a big believer of let's try to keep ourselves healthy, because once we get to the other side, it really is a challenge to get back. So once you're diagnosed with heart disease, so bypass surgery, or once now you have diabetes, it's really hard to get on the other side without medication.
Yeah, I hear you. So for everyone listening, I have a few questions for Maria. I've designed them more for you guys, but this is an opportunity that you guys can use the chat box. If I see that you guys have a question, I'll prioritize your question over mine. So we have about 30 minutes to go. You guys have the freedom to ask anything you want. I'll bring the questions up to Maria's attention. I'll read them for you guys. But one of the first questions that I have for you is, what's the difference? And I still want to, this is almost for me too, the difference between a registered dietitian and a nutritionist.
Well, first of all, the word dietitian is a protected title, and it's a regulated health professional, just like a medical doctor, a nurse, a physiotherapist. We all have colleges that we are responsible in meeting the standards. And we have a rigorous training. So just because you do 4 years of nutrition in university doesn't mean you become a registered dietitian. From there, you've got to go and do either an internship for another year in a teaching hospital, so anywhere throughout Canada, but you need to be accepted in that. So your odds are about 40% to get into an internship program, or you can do the master's route. Again, in an accredited program in one of those teaching hospitals. I was fortunate, I've done both. So hospital trained and master's trained.
Is there like a regulated body or a college for a nutritionist?
Yeah, dietitian.
For dietitian, yes, but
yeah.
nutrition.
So, and that's the key. We have the College of Dietitians in Ontario that we are responsible to. And we have standards, we have ethics, we have to do online education.
Yeah.
And maintain that knowledge every year.
Got it. And just to cross right into something a little bit more practical, and we don't need to spend too much time on this, because I have a feeling, fingers crossed, that you know, this quarantine is kind of turning around, hopefully in the next 2 to 4 weeks or whatever. But any nutritional tips for the situation that we're in right now?
There's a few, and it's interesting. I have a consult, 2 of them this afternoon, who are struggling during this time. Yeah. Number one, you really need to plan what you want to eat. Number one, do an inventory of what you have in your kitchen, in your storage, in your pantry. That, number one, will minimize how often you have to go to the grocery store to help to prevent you being exposed to the virus. Number 2, it helps you to eat better. And number 3, it takes that anxiety off of you when you have some planning of what you're going to prepare. Secondly, eat a variety of foods throughout the day. And that means your 3 meals. Doesn't matter when you start your first meal, and try to minimize your snacking. I'm having clients emailing me and they're constantly snacking. And so eat a variety, but watch how much you're eating is the other key. And the last one is it's a great opportunity to try to prepare some home cooked meals. We do have the time. If you can hone down to 3 to 5 meals right now, it'll be a lot easier once we get back to routine because you've practiced those meals. You have those favorite recipes that work. So this is really an ideal time to make nutrition a priority for you and your family.
Yeah. Everyone who's listening, maybe you just write in the chat box, yes or no, if you've had a bit of a struggle with keeping your weight as is pre-COVID. And I'll give you guys time to write that in. That's just for my own curiosity. But the next question I had for you is, what's like the typical client that goes to see you for advice? What's like the nutritional concerns? What's the typical clientele that you see?
I get a variety, but I think a lot that I get, weight loss is a huge one, okay? Everyone struggles one way or another, even with a diagnosis. So even if it's pre-diabetes, to control our diabetes, it's weight. If we can drop some weight, it will help us not to get on the medication. Fatty liver is another one. Again, it's a weight-related issue. Menopause, again, women are struggling. All of a sudden, their weight has changed, and unfortunately, it does go up as the body changes.
Is that like a hormonal thing, or?
Yeah, part of it is hormonal. Yes, definitely, because the body is changing once we hit that time period, and our activity changes. Our energies change, everything changes. And that's not only with women who age, it just happens a lot quicker with women, but I am getting a lot of male clients who are struggling with weight-related issues at the same time. Another big clientele I'm getting recently, and I'd say in the last 6 months, is young kids. So teens, pre-teens, and their families, because they're becoming more conscientious of what they're eating and of their weight. So how to keep them on track. And it's interesting, in the last 2 weeks, I've had 3 new clients, all teenagers, approaching me. I have one this afternoon, is a new one that I have. They're all approaching me that they're struggling during this time, that they're at home. And at home,
You see people with like type 2 diabetes as well?
Not as often. With type 2 diabetes, there's a lot of funding in the government to support diabetes education centers. So they're actually directed to those, they call them DEC centers, to get the whole picture because they're on medication. They need to do blood testing. They see a dietitian. They have a social worker. So they're the easy way to get into the DEC centers because they're diagnosed. I tend to see the ones before they're diagnosed with diabetes, so they call it pre-diabetic, so where their blood sugars are slightly high, and I try to encourage them. Really, my support is, let's try to get those numbers down so you don't have to go on the medication.
Yeah. And what about high cholesterol? Is that another thing that you deal with?
Yeah, high cholesterol and triglycerides. Again, those are risk factors to heart disease. And I've worked with quite a few that if you really, really work at it, you can try to bring those cholesterol levels down. 80% of the cholesterol, which people don't understand, is made in our liver. We can't control that. I've had vegetarians, even vegans, who have a high blood cholesterol. And that cholesterol is what we're making in our liver. We can't control that 80%, but that other 20%, we can sure give it a good shot to do it through diets, because sometimes that's all you need.
Yeah.
Other ones you can't, and that's why you're put on the medication to help bring those numbers down to avoid anything else happening.
Do a lot of people come to see you with the idea of certain health trends, and and what are your thoughts on those? And do you guide? Are you for them? Are you against them? What are maybe the top one or two that you do?
Okay, the top trends right now, and I don't know if people actually want to respond to them. It'd be interesting to see how many people have been on a diet. the last 5 years, the last 10 years, have you ever been on a diet?
Yeah.
Right? Yes or no?
Who hasn't?
Yes.
Let's
Keto. I see a
yeah.
keto. I see another one. Yes.
If you say yes, maybe specify what kind.
Another keto. Yes. Another one. Yes. Vegan.
There's
Okay.
also the chips and cake diet. Some of us have been on that too.
Cabbage, the cabbage diet. Again, I'm a seasoned dietitian, so I've seen quite a few, the Atkins. There's a variety, but I'm going to take it one step back. And if you actually Google the word diet, and I did that, and the first thing that comes up is from the Oxford Dictionary. It says it's the kinds of foods that a person eats. We all eat.
Yeah.
Okay, so all of us have been on some kind of diet, but again, when we're looking at a trendy diet, right now it's intermittent fasting, paleo, gluten-free, intermittent fasting, plant-based eating. Yeah. So these are the top trends in the last 5 years in terms of diets. Where we see an increase is in January. So it's not even January the 1st, January the 2nd, because people try to, what am I going to do? It's actually, if you actually look at the trends between January the 5th to January 19th, there is over 200% increase of people who go on a diet. And that number one diet at that time is keto.
Oh, really?
Right? That's the number one highest diet that people go on is a ketogenic diet. However, that drops drastically by the end of January.
It's a tough one to sustain. It takes some mental.
It's all about sustainability. So people do see me on keto, so that's a common one. The other one that you see, which it peaks in January, but it does come down a little bit, is intermittent fasting. So that's one that you could sustain, and intermittent fasting could be done a variety of ways. It could be the 5 and 2, so that means 5 days on, 2 days off. So 5 days on means 5 days I intermittent fast, which is during the work week, typically the work week, and on the weekends, people everything's free for all.
Yeah.
Then there's the 8 hours where you eat in an 8-hour window, and that's it. And then they could fast the remaining of the time. There's the 24-hour fast as well. So that's a lot easier to maintain. There are a few drawbacks to that. So people don't see me with intermittent fasting. They see me once, they tried it for a long period of time and it's no longer successful, and they're looking for, what do I do next? So with intermittent fasting, you could do it long-term. It's a lot easier for people who already have good eating habits. If you need help on your eating behaviors, developing those habits, intermittent fasting is not going to work for you to be successful, because we need to take it a step back. So where intermittent fasting is successful is you've got those last 5 to 8 pounds you need to lose, and you can do that. Okay. And then once you do that, you're not necessarily going to drop much more, because what it does, it puts you hopefully into a pattern of eating where your caloric intake is slightly less and you've burnt off those calories during the time.
Yeah, that totally makes sense. Because I've been doing it for 4 years, maybe even 5. It
Yep.
was almost before it was a trend. And what I found is that I walk around maybe about 4 pounds lighter without trying. But I mean, it doesn't mean that in the 8 hours that I'm eating bad stuff. It's not like magic. You still got to eat well. But
and that's the whole thing with intermittent fasting. You have to have the good eating habits developed before you even try that. When you try that plus intermittent fasting, it's not successful, because right now I'm seeing a few people during Ramadan. So it's the time for them to fast, certain cultures. And what's happening is that they can eat from usually 9:30 to about 3:30, 5 a.m. But doesn't matter, they're not eating well. They're just eating whatever they can. The other disadvantage with intermittent fasting is for athletes. Okay.
Yeah, we had a question for that. We got a runner. Agnes is fasting may work for you. Can runners follow this diet or athletes? Like,
Well, you just jumped into it, and that's one of the disadvantages. Or how do you do it if you are an athlete? A lot depending on when your training is, okay, and the intensity of your training. As elite athletes, it's very difficult because elite athletes will train in the morning, they train in the afternoon, they train in the evening. If you're eating in a window from 12 to 8 p.m. and you're going for an early morning run and perhaps a run at lunchtime and another run in the evening, late evenings, it's hard to maintain those energy stores. But if you're an athlete who only does evening workouts and you could eat, and then so you can change your window from, let's say, 10 a.m. to 6 and train afterwards, then you're successful. So a lot of athletes cannot do intermittent fasting because they need that energy to.
what about your weekend warrior or your not high-end athlete, but someone who goes for their runs after work and it's because they're training for some sort of marathon or 10Ks, that sort of thing? Or sometimes some of the people that are on here probably train first thing in the morning, where maybe intermittent fasting works a little bit different, where they stop eating at 6 p.m. if they're running in the morning.
That's what I'm saying. Yeah, so you can change your window.
I think it works for the most people that are here because we don't have any elite athletes who have the schedule that you're talking about. That then I would totally agree as well that if you're training 3 times a day, it's really not an option. You just need.
And also, even if you train in the morning, if you're doing a long run, again, it's very, very difficult to do a long run without having to eat anything an hour and a half before. But I also work with gymnasts who train 4 to 5 hours. And even though a lot of them are youth, I do not encourage intermittent fasting for youth at all.
Yeah,
hockey players, no.
Yeah. Like I think the ones that stick out to me are youth and anyone who's pregnant.
Definitely.
Those
they need to have good eating habits.
Yeah, for sure. I don't think intermittent fasting is bad at eating habits, but if you're growing a little person inside you, I think you want to, who's growing at that kind of rate, I think you want to be constantly eating well, but like I wouldn't do the intermittent fasting for those.
We also have to eat based on our hunger cues, and we grow up not understanding what that means. So it's a matter of eating when you're hungry. And sometimes when we follow these restrictive diets, it doesn't allow us to listen to our bodies. Sometimes we need a little bit more. If more active and you had a great workout, you're hungry and you want to eat a little bit more, we need to eat a little bit more, not to restrict yourself on that. Mm-hmm. Because that will just hinder you the following day, even just for ordinary functioning as in our daily routine.
Yeah. And then someone just asked, is there any tips to reduce breakfast carbs, cereal, toast, juice, all bad for diabetics, clearly?
My biggest thing with breakfast foods is making sure that you have protein included in your breakfast. Number one, because it's very easy for us to grab a cup of coffee with a piece of fruit or have a juice on the run, but we need that protein to sustain us with some of those carbs.
I got another question. We get together for some TV in the evening and it's prime tea time with that goes cookies or popcorn, chocolate, etc. It's become quite the habit. Any tips for substitutes? Also, what's the best substitute for sugar and coffee?
For sugar in your coffee. Okay, that's a long, okay, break it up into the
Let's go with the sugar and coffee. I think that's a common one anyways. Like, is there a good substitute for that?
Okay, what I've trained a lot of people, it takes time and it's not even looking for a substitute. We have to change our taste preferences in our mouth. Okay.
I know where you're going. That's what I've done.
And I will be an example. I used to take 2 teaspoons of sugar in my cappuccino. Like that. Every morning, not thinking about it because I found the espresso coffee too tart. So a way to minimize that sugar is not cutting it out, cut it down. So wherever you are in that sugar, is because you're craving that sugar. You taste it, you want it, is cut it back. Start with 1.5 teaspoons. Then go down to 1 teaspoon. And don't do that in a matter of 3 days. Do that in a matter of a month.
Yep.
Because it's changing that taste preference. I have a lot of people, I'm cutting out all sugar. And I said, okay, I'll see you in a month and you let me know how that goes. You can't just cut it out. You have to gradually change our taste preferences, what we're used to, because it's not an easy task. It's even like orange juice. So if we look at orange juice, in 1 glass of orange juice, and I brought this with me because I knew someone would ask about orange juice. This is an empty glass, okay? So about a cup of orange juice, if I fill this up, goes here. How many people drink orange juice, apple juice? Maybe a few? How many give it to their children?
Most.
Okay, in a juice box.
Yeah.
I have a teaspoon. Yes, I have a teaspoon. All right, so in 250 mils of juice, can you see my sugar?
Yep.
Anybody want to guess how many of these go in there?
I'm going to say 3. Hopefully not more. 4.
6.
Yeah, good for kids, eh?
Not even kids, even adults.
Yeah.
So you're looking at 24 grams of sugar in a glass. So about 23 to 25, you'll see apple juice, orange juice. And it's an easy way to cut out sugar. I'm a believer, you like your chocolate, have your chocolate. You like your brownie, have your brownie. It depends on the size of that. So it's things like the orange juice that we drink. It's great in vitamin C, but we're not getting our fiber at all from that. Okay, so it's slowly reducing the sugar that we find in our foods, and even in natural sugar that's present, because in orange juice, that's natural sugar, that's not added sugar. But again, we're not getting the fiber that fills us up. So you would never eat 3 to 4 oranges at a time, but you would easily guzzle 1 glass of orange juice. So in a can of Coke, okay, someone just asked in a can of Coke. Depending on the can of Coke, it will vary from 48 grams of sugar. So you're talking regular Coke. I assume it's a regular Coke, not zero, or you're looking at 48 to 54 grams of sugar.
Great. Yeah, I guess it depends on there's like, obviously there's diet, there's zero, there's also I think it's like Coke Life or something like that. That's stevia.
Yeah, there's Coke Light. Now there's zero. There's a variety of ones. But again, it's that taste people want because they're used to it. So it's a matter of training our taste buds.
I got a good question here that I think is going to be relevant for just about everyone who's listening. Before I ask it, because this is flying by like it always does, we're almost at 11:30, and then we'll take more questions right till the end. If you guys have a trend or a topic that you'd like to talk more about, Maria's going to be joining us next Wednesday for basically part 2, where we can dive into whether it's intermittent fasting or plant-based eating or any of the other trends. I want you guys to suggest it with the whatever it is, 5-10 minutes we have left. Whatever I hear come up the most, we'll probably end up choosing maybe 1, 2, or 3 topics and elaborate on those. The question was, what should one do to prevent emotional eating? Must be a few answers to that one.
Right now, this is a time a lot of people are struggling with emotional eating for a variety of reasons. And it's all about being mindful. We have to take a step back and what is causing that emotional eating. Okay, my background is not psychology for sure. So if that emotional eating has to deal with some kind of family stress that you need to get support there, or is it emotional eating out of boredom? Okay. I always take a step back and ask people, why is it happening? At what times of the day is it happening? I know a lot of people have emotional eating in the evening. So why is that happening? They're bored,
Mm-hmm.
right? You got nothing to do. It happens in the evening.
Yeah.
So how do you entertain yourself in the evening time? Right? And even watching TV or that's actually another reason people will sit there and constantly feed. It's the action of actually your hands are bored.
Yeah.
So they just go to the mouth. So one thing I teach people, I said, okay, so it's your time to relax. You're watching TV, Netflix, everything's on Netflix right now. What can we do? So I said, you know what? Google. When your hands are on your iPad, you're on your computer, you don't have time for your hands to reach your mouth at all.
Yeah.
Take notes. Whatever you're watching, what resonated with you at that time? As long as you're keeping your hands busy is a great thing to do. If not, it's very easy. So it's all about listening. It's those cues about listening to our bodies, which we don't grow up to do. And that's why I've worked a lot with young children, because we want to teach our kids to understand when they're hungry, not for mom, dad, grandparents, caregivers running after them with the teaspoon or the fork. You got to eat. You got to eat. Children really understand when they're hungry and will eat when they're hungry. And there's a time and all that. And that's a topic around children that I can talk for hours on.
I like it. Like for me, what I find has helped. So I'm just copy and pasting the questions so that I have them for next week. When I work out in the evening, I don't know if it's the endorphin release, probably similar to people who run, but that endorphin release takes care of the cravings I would have had that night. And when I do skip the workout, that's when I got to battle it a little bit. And
You're
I'll find
bored.
myself walking to the fridge, opening it. The other trick I have is I don't have anything in the fridge or the cupboards during the weekdays for me to have, but I'll still go and look and see if I can muster up something. And I usually can't. So I just I have to go back and,
Well, actually, Jeremy,
something.
That's a valid thing to say. Out of sight, out of mind.
Yeah.
And that's why I encourage people, don't buy it. If you buy it, you're going to eat it. And if you can't control your eating habits around that, don't have it in the house. And then I hear people, my kids want it.
I know, that's my next question. What about, if there's kids in the house, what about them? Well, it's like, well, should they be having it every night too? I don't know. Like,
And
I grew up and I was used to having dessert. And I think things have changed in the last 30 years where maybe it's not as common. It is for some families for sure, but it wouldn't be in my house. But what are your thoughts on that?
So the whole thing is, why would we want to give it to our children? So I throw it back to you. Why would we want to give 6 cookies to our kids right before they go to bed? Same reason.
I was having that conversation with my parents this week. I was like, we're talking about desserts. And I was like, do you guys remember every time they come back from Costco, they'd buy the best cookies. There was always dessert on the counter. It was second nature. That's where you go after dinner. The way that I see it now, I would never do that. I was like, you guys fed me so much stuff. I can't believe I didn't gain for weight.
But also think about if it's available,
yeah,
and it's not restrictive, you can go help yourself have one. It's when that restrictive behavior and the guilt comes into place. So don't feel guilty to have that one cookie, but if you're gonna have half a dozen, then that's a concern. And also I teach a lot of people about everyday foods and sometimes foods. So those everyday foods are those foods that really help our brain, help our body, help our muscles, help our gut. And what are those sometimes foods? It really those sometimes foods is emotional and taste. So what are the foods we're going to have every day, all the time? And it's not to say we can't have those sometimes foods. It's limiting those sometimes foods and not being so restrictive. So it's okay to have a piece of brownie, but how big are you cutting that brownie? Because if you have that one small brownie, you're okay. But if you have that brownie in the evening time, and then you're having the bag of chips, in the afternoon, and then, okay, now I'm looking for some nuts and some popcorn and
I think it depends on the person's habits and personality. Like for me, I just can't have that one brownie. I'm going to be honest with myself. I'll just finish the bag. So I just don't buy it. And so that's how I cope. And the way you cope might be that you can do the half brownie and move on and do a little bit every day. I've tried it. I feel like I'm just fighting it. So I just don't buy it. And then that's my solution. It works for me.
And that's actually valid, because when I work with people, what works with one person is not necessarily going to work with someone else. And that even comes to any dieting regime. Not everyone is going to be successful on keto. Not everyone is going to be successful on intermittent fasting. Not everyone is going to be successful on plant-based eating. Yeah. So even though they're trendy, everybody's body and behavior around the eating and what they could be successful at. So for you, you know your weak point. If it's there, you're going to devour it.
Yeah. And a lot of people I don't think are fully self-aware yet. And that's where someone like you might come into play. It's like, hey, well, what's the right thing for me? Because it hasn't been working yet. You know what I mean?
I think we all know what to do. We all know we need to eat more vegetables. We all need to know we need to cut back on these foods. Where my job is to help you and to teach you how to do it. Mm-hmm. It's the how to. We all know what we're supposed to do.
Yeah.
We hear about it all the time. Eat more vegetables. How do you eat more vegetables? And that's where I really help people to incorporate vegetables 2 to 3 times into their meal plan.
Yeah, the other thing that I like about your approach, and it was one of the most appealing things to bring you onto our team at UTM, is you can start from scratch when it comes to like walking someone through a grocery store, where to shop, how to shop, what aisles to be in and which ones to avoid, all that kind of stuff. You want to elaborate on that a bit?
Yeah, well, it's not even avoiding a whole aisle. It's even when you're in an aisle, how do you decipher? The reality is you go down cereals, there's lots of cereal options there, okay? How do you decipher a better option versus another one? How do we look at those labels, especially with cereals? And the labeling around that is very inconsistent. So my role is to teach you, how do you choose, if you're going to choose to have cereal in your diet, what is the best way? Which is the best one to look for? And it's not to say you can't have it. Maybe it's having a little bit less of that and choosing a better option. Because yeah, the parameters of the grocery store is the best place to be. But in today's times, inside the aisles is where a lot of people are spending their time. They're getting packaged foods, lots of packaged foods to make meals easier. I was in the grocery store a few weeks back and I saw someone in the grocery cart with 10 pizza boxes. Not like 1 or 2, it's 10. And do we need 10? Right? But we're in a crisis, we're not running out of food. I want to reassure people we're not running out of food. So get those basic pantry items and I have a list of those that are going to be successful during this time.
I don't know why I got this sudden craving for pizza right now.
Oh, should have brought that one up.
So, okay, we're getting a little bit thin on time. I've copied and pasted the questions that we didn't get to and the subjects that we can cover in 1 week's time. We still have a little bit of time. I just want to, before this thing closes up on us, I want to thank you for coming. There's a part 2 to this, so guys, don't worry if you didn't get your questions answered. I also want to let you guys know this Saturday, there will not be a webinar. We're going to do one with the sport physicians. We're going to move that one to probably sometime in June or July when we're back in practice. They were going to talk about sort of their role during COVID and how they're handling patients and seeing patients. It looks like this is turning around, so that talk is no longer as relevant. We will do one with them talking about how sport medicine works with physio and nutrition and chiro and all that stuff. That'll be at a later time. So pass the word on if anyone else was looking forward to it or wasn't here today and expecting us to be there on Saturday. Otherwise, Maria, big thank you. We'll see you in 1 week, same time, same place. Cool?
Sounds good.
All right. We'll see you then. See you guys. Thanks for coming.